I now invite the President and Vice-Chancellor, Professor Margaret Gardner, to present the first candidate to the degree of Doctor of Laws, honoris causa.
Deputy Chancellor, Dr. Marcy McCall MacBain, together with her husband, Mr. John McCall MacBain, are notable international philanthropists, and together they are the co-founders and co-directors of the McCall MacBain Foundation. Since its formation, the Foundation has committed $200 million to fund projects relating to scholarships and education, health and the environment in Canada, Europe, West Africa and Australia. Dr. McCall MacBain earned qualifications in arts and science before completing her Doctor of Philosophy at the University of Oxford. Her early professional career was in spinal cord injuries, but her broader interest developed into public health and evidence-based medicine, which was advanced through her role with the Foundation. Dr. McCall MacBain has also concentrated her work on improving resource allocation for healthcare training and delivery, with special interests in maternal health in sub-Saharan Africa. The Foundation and Dr. McCall MacBain are committed to improving the welfare of humanity through focused grants across education, health and the environment. With this focus, the Foundation has given substantial support to the inhaled oxytocin project at the Monash Institute of Pharmaceutical Sciences. This project is developing an inhaled medicine to prevent postpartum hemorrhage and the loss of mothers' lives in childbirth. Dr. McCall MacBain's commitment to the inhaled oxytocin project has been fundamental in its continued development. The support that the Foundation has provided has also encouraged other organisations around the world to contribute to this globally important initiative, an initiative that is one that provides something very important to significantly disadvantaged communities. Dr. McCall MacBain is also a Senior Research Fellow at the Department of Primary Care Health Sciences at the University of Oxford and Director of Online Education, and Senior Research Fellow at Kellogg College at the University of Oxford. Deputy Chancellor, it gives me the greatest pleasure to present to you for admission to the degree of Doctor of Laws, honoris causa, Marcy McCall MacBain.
With the authority of Council, I admit you, Marcy McCall MacBain, to the degree of Doctors of Laws, honoris causa. I now have much pleasure in inviting Dr. Marcy McCall MacBain to deliver the first graduation address.
Thank you so much for having me and welcome to this wonderful ceremony. Usually I'm up there in those seats, so it's been such a privilege to be first in front row to see these wonderful graduates and their faces of optimism and hard work. Deputy Chancellor Mr. Shane Buggle, President and Vice Chancellor Professor Margaret Gardner, Dean of the Faculty of Pharmacy and Pharmaceutical Sciences, Professor Bill Charman, distinguished members of the faculty, and all of the special guests, especially our new graduates of 2018. It is my great honor to be with you today at the Monash University. It is a special day. A special day in your academic history because today you are graduating from one of the most prestigious universities in the world. This day marks the completion of yet another phase in your studies, completing in your chosen field in a subject area that will relate to improving healthcare and delivering better medicine. In a world that eradicated smallpox in 1980, in a world that has increased its life expectancy of its citizens, has invented antibiotics, and are on the road to tackle malaria and tracking the Congo for the next potential Zika outbreak. We are, however, also in a world where we are still trying to find the solution to dampen the critical rise of diabetes and obesity and deaths related to chronic disease. We are in an escalated fight to end cancer, and we all wonder, are we even close to winning? For whatever dream, whatever ambition, or stroke of medical good reason that you had to bring yourself to this university to complete your degree, let us honor that impetus today. Quam at bonus disciplis in Australia, ubi biberi possumus plana fantastica alba, ineptus roncus purus, ut agradiu in medicorum disciplinum, ut esset onus ex vobis unum decursu historiae mutari. In Australian, that should loosely translate to what a bonus to be a student in Australia, where we can drink fantastic flat whites, surf oneself silly, and you also get a degree in the medical discipline so that one or more of you might be the one to change the course of history. Roncus purus, by the way, I think is the equivalent to surfing in Latin. Just as you started school at Monash University with a dream, an ambition, and probably that few strokes of good reason, so did we at the McCall-MacBain Foundation. We established ourselves in Geneva in 2007. We had dreams and guiding principles and a few strokes of what we thought were good reasons. And over time, we experimented with projects to improve access to quality education, to ebb the climate change crisis. And most relevantly, for our distinguished honor today, we wanted to improve the outcomes of maternal health care. I will let you hear from John on his view and lessons learned from his career in business, but what I wanted to share you today was a few reflections on our work in philanthropy and how it relates to our journey in maternal mortality. In 2007, when we started the foundation, 1 in 16 pregnant women in Liberia was dying during childbirth. With an infant mortality rate of 7 deaths per 100, Liberia was terrible in all metrics. Corruption was pervasive, poverty, and a GDP per capita of $620 compared to your Australian $40,000. At the time we entered Liberia, its culture was also reeling from a 14-year civil war. The effects included all the misery and torture that most of us only fear, including rape, murder, violence, and unmeasurable loss of years of quality and quantity of life. There were severely undiagnosed mental health consequences to all of this trauma. We saw dilapidated infrastructures, limited schooling availabilities, no health care, with lack of education and scarce human resources to run a democratic government, never mind developing a functional healthcare system. Starting work in Liberia with such a low barometer of human resources was a bold choice, but an obvious one when we looked at the odds for their success without any investment. After working in the country for 3 years, though, it became blindingly obvious to us that we were not working with full information. Not least, I was asking myself, where was the evidence for these grants and interventions we were supporting? In healthcare and in education, how do we know that this training for midwives will work to produce better healthcare outcomes? Which literacy program, we were asking ourselves, was better than the other? What are the pressing healthcare issues for this community and this population specifically? And what are the demonstrable methods that we can use to address these issues? As we know, the international government and non-governmental organizations, including private foundations such as ours, have spent decades and trillions of dollars to solve healthcare crises in the field in the continent of Africa and worldwide. With some success, but it was after reading Bill Easterly's book and the poignant voice of Elizabeth Busani, who wrote about the wisdom of whores, and understanding the proliferation of the HIV, it convinced me that if you keep asking the same questions to the same people on the outside of the problem, all the while using the same methods of research, used by the groups or individuals who may or may not have an incentive to reveal the truth, well, guess what? You end up with a circular logic, with answers that may not only hinder the speed of success, but may increase the chance of failure. a glaring version of the ivory tower syndrome, in my view. So that's when I went back to school and studied evidence-based healthcare at the University of Oxford, and I guess the comment on ivory tower is not lost on me. However, I found that a group of academics in healthcare who are committed and are wonderfully pragmatic, all geared to solve a problem, and in evidence-based healthcare in particular, meeting physicians and researchers, scientists, and pharmacists looking for positive impact. Solutions to problems are at hand and will help change the lives of patients. At this point in your career, perhaps you have a clear goal in mind, an outcome, a vision of where you want to be in 10 years. Setting a goal is key, and if I could, from my humble place here today, urge you to allow yourself time to change a strategy towards that goal, the project plan, or as we sometimes affectionately call it, design development. Committing to a design development phase in your career will allow you the permission to experiment a little bit, to try, to go boldly where you never thought you'd go, and then observe, redesign, and ultimately do better. For example, when we take our investment in the oxytocin project here in Monash, the investment came as a part of an iterative and in-depth exploration into why women were losing their lives in childbirth, and what we could do as a small private foundation to help out. At first glance, the evidence suggested a number of things that were causing maternal mortality. Little or no access to most healthcare services, lack of trained midwives, very young mothers, but also during our exploration phase to address the issue of maternal deaths. In the field, by asking physicians and understanding the bottlenecks in evidence, what we found was a lack of access to electricity prevented the refrigeration of a life-saving medicine called oxytocin. Oxytocin, for the non-medicinal folk in the audience, is naturally occurring. It contracts the uterus and prevents post-hemorrhage death. It's highly effective when it's used to restrict the blood loss. And this drug saved my life in Geneva in 2010. So by encouraging Monash University and helping to create a stable form of oxytocin that does not require refrigeration, in our own small way, we hope that collaborating with your university will have some very positive effects for women in the near future. We could not have known in 2007, however, that we would be investing alongside Big Pharma. But by having our goal in mind and being flexible and having partnerships, we were able to adapt our strategies to achieve an end goal that was mutual. And now, as an academic immersed in the evidence-based paradigm, I try to infuse the Descartes method of deduction with a humanistic pull for innovation. And I believe this approach is also infusing our approach to philanthropy. In essence, evidence-based thinking takes and encourages better question asking. And then it includes the application of patient values and evidence to support and experience a solution to the problem. Driven by impact, of course, we do obsess about the end goal, and as we should, but we seek to understand it, not only just the benefits, but also the harms, and try to move where the evidence lies. This pragmatic approach doesn't strip away the passion. On the contrary, we always try to include the issues that we know a little something about before we grant, which leads me to my final wish for you as the recent graduates. May each of you strive for the optimal Venn diagram in your careers. Wherever it is that you seek positive impact, define your work on the expressed needs of the population that you care about, with good evidence and a stepwise approach to inform your decision. And above all, accelerate your passion and carve out your area of expertise, because in the end, it is your combination of passion, of motivation, and that magical stroke of good reason that we need most to succeed in healthcare. Congratulations and good luck.